Hello dear friends, that's me again, Dr. Maksim Goncharov, psychiatrist, psychotherapist and director of Center for Positive Psychotherapy. Thank you for your questions and comments. For the last period we received a lot of questions about depersonalization syndrome. What is it? Well, the depersonalization, this is the mental state where a person experiences his feelings or thoughts or any other psychological experience as something detached from his personality. Well, this experience is quite threatening, and person experiences himself as splitted, not whole. There are basically two main points of view to this phenomenon. One is psychiatric. From psychiatric point of view, the reasons for depersonalization is not that much important. Usually, the depersonalization considered as a syndrome that can accompany schizophrenia or some neurosis or other endogenous disorders. As psychotherapist, I'm not very much interested in psychiatric perspective. So, from psychological, psychotherapeutic perspective, depersonalization, this is another way to process the conflicts. And as in other talks, we already discussed the meaning and function of any sort of symptom. Symptom always has a function and meaning, so it's called positive interpretation when we try to see this function. So when person goes through a difficult experience, difficult inner conflict, our personality tries to protect itself. So it tries to detach some of the fragments of our psyche. So this process is called dissociation. Okay? So in this sense, normally our psyche is able to split up into fragments and then complete as a whole again. And that's a very important capacity. So depersonalization usually appears where a person tries to lower the intensity of the conflicts and tries to separate it from the personality. Okay? In this sense, the pain, inner pain from the conflicts becomes lower. So if you experience depersonalization, don't be too scared. Of course, you better talk to psychologists or psychotherapists and try to step back from the conflict, from symptom to conflict, and try to see the reason for this way of processing the conflict. Well, that's it. I hope it was interesting for you, and thank you for your questions and comments. See you in the future. Bye-bye.